There were several misconceptions that greeted the rollout of the COVID-19 vaccines across the world. Although the World Health Organization and other stakeholders in the health sector have been working to disabuse the minds of the public on the misconceptions, negative perceptions surrounding vaccine intake continue to emerge. Health officials in the Ashanti region are rolling out the vaccines to immunize pregnant women and have begun to sensitize the public on some misconceptions.
All the processes that we are going through are evidence-based and is based on science. So what people are talking about is based on speculation. They are just speculating. But the reality is that from evidence-based or from our scientific knowledge, we now know that the vaccine is safe for pregnant women. So nobody should think of abortion, miscarriage, and other things. It may be coincidental. You may take the vaccine and you may abort. Sometimes abortion happens spontaneous, but don't associate it with the vaccine. On the other hand, if you take the vaccine and you have any reaction, the first thing you have to do is to report to the nearest healthcare facility and inform them that you took the vaccine so that the necessary action will be paid. What I'm saying is that we're also doing advocacy and social mobilization and communicating to the people. So I believe that the people will have confidence in us.
The Ghana Health Service is targeting to vaccinate a total of 3,835,045 of the population in the Ashanti region and has so far vaccinated 200,377 persons. 637,628, representing 16.6%, have fully vaccinated, while 1,612,802 persons, representing 42.1%, have taken at least one dose. Ashanti Regional Director of the Ghana Health Service, Dr. Emmanuel Tinkran, is encouraging persons who qualify for booster jabs to go in for them.
The vaccines are safe in pregnancy. Then we'll have to prioritize pregnant women and then give it to them. We are recommending Moderna and Pfizer for the pregnant women. And then the first dose will be given as early as possible in pregnancy. And then the second dose will follow that of the general population. So for Pfizer, when you take the first dose, you wait, and then 3 weeks, you take the second dose. And then for Moderna, when you take the first dose, you have to wait for 4 weeks before you are given the second dose. So we are going to do same for the pregnant women. And that is the new policy that we are going to start from now. It is also the aim of the service to give a booster dose to the high-risk population, because we know that immunity for COVID-19 usually wanes. So when you take the vaccine from 3 months to 6 months, you realize that the immunity will drop a bit. And for that reason, for the high-risk group, we are starting the booster vaccination for them. We also have new strains that usually appears, and for that reason, when you give the booster dose, then you reduce the risk.
The Ashanti region currently has 61 active COVID-19 cases.
Hafiz Tijani, City News, Kumasi.